Hello, dear colleagues. Welcome back to our training series on botulinum toxin in aesthetic medicine. In this second lecture, we will focus on one of the most important and sometimes underestimated aspects of successful treatment: patient selection. Not every patient is a good candidate for botulinum toxin. If indications are not carefully evaluated, we risk patient dissatisfaction, limited results, or even complications. Today, we will explore the key criteria for selecting patients, the different muscle behavior patterns, and the main contraindications you must always keep in mind. Indications for botulinum toxin. Aging is the result of both intrinsic and extrinsic factors. Intrinsic aging relates to chronological changes, loss of skin elasticity, laxity, sagging, and gravitational folds, such as eye bags or jowls. These are best addressed surgically, not with botulinum toxin. Extrinsic aging results from photo damage and environmental factors. Here we see wrinkles, dryness, pigmentation, and aging spots. This type of aging is where botulinum toxin, alongside lasers, peels, fillers, and other treatments, plays a central role. In aesthetics, the most common indication is the treatment of mimic wrinkles, those dynamic lines caused by muscular expression. Facial expressions are essential for human communication. When emotions are unintentionally misprojected due to abnormal muscular activity, patients may look tired, angry, or sad, even if they feel perfectly fine. Botulinum toxin helps us restore harmony between inner emotions and outer appearance. Muscular behavior patterns. Before any injection, we must carefully analyze the muscular pattern of each patient. This determines not only the dose, but also the choice of injection sites. Patients can be broadly divided into three groups. Kinetic patients. Their expression matches their emotions. They contract their muscles when they want to. For example, when surprised, the frontalis contracts and raises the eyebrows. When angry, the corrugators contract. These patients are ideal candidates. The duration of effect is the longest, often 7 to 9 months, sometimes even longer. Usually, they need treatment only once per year. After injection, wrinkle formation disappears almost completely, and patient satisfaction is very high. Hyperkinetic patients. Their muscles contract excessively and often involuntarily. There is no perfect concordance between emotion and muscular activity. For example, corrugators may contract repeatedly during speech, even when no anger is present. Wrinkles are dynamic but not static. Treatment results last shorter, usually 4 to 6 months, sometimes even less. These patients often need 2 or 3 treatments per year. They represent the most common patient group for botulinum toxin. While they are pleased with the results, they often wish the effect could last longer. Hypertonic patients. This is the most challenging group. Their statement is, "I cannot relax." Even at rest, their corrugators and procerus remain contracted, projecting constant anger, sadness, or fatigue. After treatment, results are limited. Muscle relaxation may last only 1 to 2 months. Wrinkles do not disappear completely. These patients may require 4 to 5 treatments per year, often in combination with fillers or other modalities. They are also the group most prone to dissatisfaction if expectations are not carefully managed. Outcome analysis. When analyzing treatment outcomes, remember, our goal is not complete paralysis, but a natural look. Excessive blocking may create an unnatural or frozen expression. Partial hypokinesis, where a small amount of movement remains, is usually the most aesthetically pleasing. Overtreatment of muscles, such as the frontalis, may lead to complications like brow ptosis or an unnatural, heavy look. Always explain to your patients that some residual movement is desirable and does not mean treatment failure. Contraindications. Even if the indication is correct, treatment must be avoided in certain patients. Contraindications are divided into 3 groups: general contraindications, patients with unrealistic expectations or body dysmorphic disorders, severe psychiatric or emotional disorders, patients who cannot accept the limitations of botulinum toxin, drug-specific contraindications, neuromuscular diseases such as myasthenia gravis, ALS, or Eaton-Lambert syndrome, hypersensitivity to botulinum toxin or its excipients, pregnancy and breastfeeding. Treatment should generally be avoided. Injection-related contraindications, bleeding disorders, or concurrent use of anticoagulant drugs may increase the risk of bruising. Interactions with aminoglycosides or other agents that interfere with neuromuscular transmission must also be considered. Tips and tricks. The best candidates to start with are kinetic patients. They respond predictably and give high satisfaction. Hyperkinetic patients will need regular follow-up and retreatment. Hypertonic patients should be informed from the beginning about the limitations of botulinum toxin monotherapy. They often require combination treatments. Above all, tailor the treatment plan to the muscular pattern of each patient. Closing. Dear colleagues, in this lecture, we reviewed how to select the right patients for botulinum toxin treatment, the differences between intrinsic and extrinsic aging, the three main patient types, kinetic, hyperkinetic, and hypertonic, the importance of individualized dosing and avoiding overtreatment, and the contraindications that ensure patient safety. Patient selection is the foundation of success in aesthetic medicine. When we choose the right patients, results are natural, safe, and satisfying for both the patient and the injector. In our next lecture, we will move forward into practical aspects of injection techniques and dosage considerations. Thank you for watching. If you found this lecture helpful, please like and subscribe so you don't miss the upcoming videos in this complete training series.